So we're going to be discussing today the clinical implications of cystic fibrosis. And we must understand, how does cystic fibrosis come about from the genetics. So it's a genetic disease that we would have a failure in the transcription and the later supposed translation of the gene that would make for us the cystic fibrosis transmembrane regulator, CFTR. So this cystic fibrosis transmembrane regulator is a protein. We're never getting a protein unless we translate mRNA in the ribosome. And we're never getting an mRNA transcript unless we transcribe the DNA in a particular region. So the mutation here prevents the transcription of the CFTR, cystic fibrosis transmembrane regulator, and then we wouldn't have our mRNA transcript. Then we cannot translate that mRNA transcript into the cystic fibrosis membrane regulator protein. So since we don't have it, we will not be able to transport chloride across the membrane. And here we're going to see this is going to have a multi-system effects. These multi-system effects are going to range from the respiratory system. Patients would have um, sinusitis. They would have excessive salty sweat that would cause disruption in osmotic balance and hypovolemia and water leaving the body into the skin. Patients would have liver cirrhosis. Patients would also have pancreas exocrine dysfunction, as well as malabsorption and engorgement of the large intestine with fecal matter that is greasy and large in size, because there is it is the fecal matter is very dehydrated, and we will see that the small intestine will never be able to um, reabsorb or the fat soluble enzymes, and we will see that male patients would even go as far as developing infertility and azoospermia, and there would be bilateral obstruction of the vas deferens. So we're going to go in depth about these.